talk about this scenario which involves a sexually transmitted disease, which are also called sexually transmitted infections. So our scenario is a 25-year-old man who reports having unprotected sexual intercourse with multiple partners, presents to the clinic complaining of painful urethral discharge for 3 days. So given this history, having unprotected sexual intercourse with multiple partners puts the patient at risk of a number of different infections. But given the patient's chief complaint, which he's complaining of right now, which is painful urethral discharge, we know that the most common bacterial causes of this condition are number one, chlamydia trachomatis, and number two, Neisseria gonorrhea. So this is where it gets interesting, because chlamydia and Neisseria, although they're both bacteria, they're very different from each other. Chlamydia is called an atypical type of organism, which means that it's called atypical because it does not have a cell wall, unlike Neisseria. Neisseria does have a cell wall, and it's actually a gram-negative organism. So this poses, first of all, if chlamydia does not have a cell wall and Neisseria does have a cell wall, it means that when I think about treatment, how can I eliminate these bacteria, how can I kill them, I should use a different approach for each and every organism of these two. In case of chlamydia, I cannot use a cell wall inhibitor, such as ceftriaxone. I cannot use it because chlamydia does not have a cell wall. Instead, I would use a drug that inhibits the protein synthesis, or that inhibits ribosomes in the chlamydia, which is, for example, azithromycin. On the other hand, regarding Neisseria, which does have a cell wall, I can use a cell wall inhibitor such as ceftriaxone, which is the first-line drug to treat this condition. If I take this thought process a step further, and if I take a sample of this urethral discharge and I send it to a microbiology lab, let's say they perform a gram stain, which stains the cell wall of the organism, and they tell me, hey, we cannot find anything on gram stain. This doesn't mean anything, because if the patient were to have chlamydia, it wouldn't show up anyways in the gram stain. So this also poses a different another limitation to the process. However, if they told me that I have a gram-negative organism, this tells me that maybe this patient is having Neisseria, for example. Also, if they were to culture, let's say the patient has Neisseria and they culture it, they can also check which type of antibiotics work. So let's say that they put ceftriaxone on the culture, and the bacteria does not die from ceftriaxone. That means that Neisseria that this patient is having is resistant to ceftriaxone. So the physician might not use the first-line agent, which is ceftriaxone, which is usually used, and might go for another drug, which is a stronger medication, for example. And knowing that chlamydia, for example, is a very weird organism, it's very difficult to culture, very difficult to grow, we can use other techniques to look for the actual DNA of chlamydia to aid the diagnosis. So this was just an effort to show you that microbiology is not just about learning bacteria and memorizing, this bacteria has a cell wall, this does not have a cell wall, this is gram positive, this is gram negative. The idea is that this has a lot of implications, not only on medicine, as we have just seen, in terms of pharmacology, treatment, and the lab results, but also, if we think about it, it also goes a step further and cares about the health of the population as a whole. We know that it's very probable that these organisms that the patient had could have been easily contracted to other partners, sexual partners. So in that case, we should educate the patient, tell them that this is very risky behavior, which he's doing, and we should also inform the public health officials. For example, in the U.S., it's you as a physician must report these sexually transmitted diseases. You must call the health center of the place you're living in, tell them that I got a case of, for example, chlamydia or Neisseria, and they in turn should look for the patient and ask them, please tell us who are your partners in order to treat them.